Hi, is this Mrs. Anderson?
Hello, this is Betty Anderson.
Hi, Betty. My name is Alina Sibley. I'm a nurse practitioner and I'm calling from Rosewood Nursing Home. I wanted to update you on how your husband is doing and to discuss with you a little bit what it means, what lies ahead, that sort of thing. Would that be okay?
Yes, how is he feeling? Is he okay?
Well, I'm sorry to say his condition has worsened quicker than we thought. He's a little more confused. I'm worried about him. I'm worried time may be short, and that's part of the reason I'm calling you.
Oh no.
Yeah, I wish things were different. I'm sorry to have this conversation, but I wanted to know whether your husband ever discussed with you what his wishes would be should his health decline.
Yes, he's always wanted everything done so long as he could return to Rosewood and do his favorite things.
So what do you think means the most to him? What has meant the most to him, and what has given his life meaning, do you think?
Well, he loves our visits, especially when I bring our little dog Fred. He likes to play dominoes with his friends.
Mm-hmm.
He looks forward to seeing our grandchildren and going on short walks with them.
Yeah, he did mention his dog and really enjoying your visits and seeing the grandkids, loving to see the grandkids. He smiled when we talked about it. It was a nice conversation. May I also share a little bit more about what we talked about with him about the disease progression?
Yes, please do.
Yeah. So we talked about COVID-19 and how it seems a lot of his symptoms are progressing and what going to the hospital might look like for him versus staying at Rosewood. And to be honest, given his age and his lung disease and diabetes, with hospitalization, he would most likely be placed on machines to keep him alive at this point if he had to go into the hospital for his breathing. And he might be isolated from seeing anyone because of COVID, except for the nurses and doctors taking care of him. The fact that he's already a little confused, I would expect that this would only worsen at the hospital. So I'm really concerned that the odds are against us when it comes to this. And he might, die on the ventilator if that's the route that was taken. He did mention briefly not wanting to go to the hospital for further treatment. So let me stop for a minute and check in with you. I know this is a lot to hear. How are you doing?
Well, I know he was sick, but I didn't realize how quickly he'd go downhill. I mean, he had pneumonia last year and he recovered. How is this any different?
Yeah, I'm afraid he's not as strong as he was last year, and this virus is definitely more aggressive. Many people in his situation are not surviving even on the ventilator, on the machines, the breathing machines. So even if he did survive, I'm worried he would not regain enough strength to be able to come back to his baseline and kind of enjoy those things that he really, really has enjoyed. I really wish things were different, and I just can't imagine how hard this is for you to hear.
It is. What kind of treatment would he receive at Rosewood if he doesn't go to the hospital?
So we would continue to aggressively treat his cough and shortness of breath and support him here with comfort measures. Comfort care is what we call it.
Are you telling me he's going to die there?
Well, if this continues the route that it's going, he may, and many people do in this situation. But we're going to continue to do everything possible to treat him and also to keep him comfortable. Based on our earlier conversations with him, it really sounded like he would not have wanted to be put on machines and would have wanted to stay here and be kept comfortable. Do you agree that's kind of what he would want?
I certainly want to honor his wishes. I hate that this is happening. This virus seems to come out of nowhere. It's hard for my family and me. And if I see things through his eyes, I'll support his decision to keep him at Rosewood.
Yeah. It is really, really a tough situation, and I agree with you. I'd like to be able to support you during this time. What can we do at Rosewood here to help? Can we involve a social worker through this time just to give you further support, or a chaplain?
I'll have to let you know. Thank you. I appreciate you calling and letting me know.
Absolutely. You take care, and thank you so much for having this conversation with me. Bye-bye.